gross facts about your sexual acts. What is an STI? An STI is an infection passed from person to person through intimate sexual contact. Some common STIs at the University of Saskatchewan are chlamydia, gonorrhea, genital herpes, and human papillomavirus. First, let's look at chlamydia. Females and males experience different symptoms of chlamydia. Females can have vaginal bleeding between periods, vaginal discharge, pain in the lower back or abdomen, and pain during intercourse, whereas men can experience penile discharge, testicular pain and swelling, and penile itching. Testing is done through a simple urine test, and chlamydia is usually easily treated with antibiotics. Fun fact, 50% of infected males and 70% of infected females do not have symptoms or are unaware of their chlamydia infection. Next, let's consider gonorrhea. Like chlamydia, females and males have different symptom profiles when they have an active gonorrhea infection. Females rarely have symptoms, but if they do, they can take the form of vaginal discharge, vaginal bleeding between periods, pain in the lower back or abdomen, and pain during intercourse. Males typically experience thick yellow-green discharge from the penis, testicular pain or swelling, and penile itching. Also like chlamydia, testing is done through a urine test, and gonorrhea is usually easily treated with antibiotics. Fun fact, gonorrhea is the second most common bacterial STI in Canada, and numbers are on the rise. Next, let's look at genital herpes. Common symptoms of genital herpes involve flu-like symptoms like fever and aches, the presence of blisters or sores around the genitals or rectum, and painful urination. These symptoms are seen in both males and females. Testing for herpes is done through swabbing an active lesion. Unfortunately, there is no cure for genital herpes, but use of antiviral medications can decrease the duration and severity of outbreaks. Fun fact, using condoms and avoiding intercourse when a partner has symptoms or active lesions helps prevent transmission of genital herpes. Finally, let's look at human papillomavirus, more commonly referred to as HPV. HPV is usually asymptomatic, meaning there are often no symptoms. Sometimes, however, affected individuals will develop cauliflower-like warts on the penis, vulva, or genitals. Testing for HPV is done through either visual inspection by a healthcare provider or through routine pap testing. There is no treatment for HPV, as the affected individual's immune system typically clears the virus in 1 to 2 years. However, there is a vaccine available to prevent HPV infection for females aged 9 to 45 and males aged 9 to 26. Fun fact, approximately 75% of sexually active Canadians will have at least one HPV infection in their lifetime. The highest rates occur within those aged 15 to 24. How can you prevent the transmission of STIs? One excellent method is to always use a condom or other barrier contraceptive method, like a dental dam. Another method would be to talk with your partner about their sexual history. Or, if you are being treated for an STI, avoid all sexual activity until both you and your partner have been treated. A final and surefire way of preventing STIs is to remain abstinent from all sexual activity. If you think you may have an STI, make sure to visit Student Health Services on 4th floor Place Royale to be tested as soon as possible. For more gross facts about your sexual acts, talk to your healthcare provider, visit the Peer Health Usask Facebook page, or pick up a Peer Health pamphlet on 3rd floor Place Royale or at one of our display boards around campus.